Thank you. So my research topic is the neurobiological and psychological effects of childhood stress and maltreatment. So my table of contents, so childhood maltreatment introduction, I'll talk about the psychological effects and the neurobiological effects, resilience, sex differences, and my conclusion. So what is childhood maltreatment? Childhood maltreatment is any harm done to a child's well-being, development, trust, and power. There are four types of childhood maltreatment: physical abuse, sexual abuse, emotional, and neglect. Physical abuse is when a caregiver or legal guardian inflicts any physical pain on a child that ends up leaving a mark, bruise, cut, or burn. Sexual abuse is exposing a child to any sexual activities. Emotional abuse is non-physical abuse, and it's where a caregiver or legal guardian manipulates or humiliates a child's mental well-being. And neglect is the failure to provide basic necessities and care, whether that's whether that's emotionally or physically. So the psychological effects of childhood maltreatment. So they can be linked to many psychological consequences, including being at risk for mental illnesses, behavioral dilemmas, and poor physical health. Research concludes that children who have suffered from childhood maltreatment have the highest number when it comes to suicide, especially before the age of 7. I've included a picture of adverse childhood experiences pyramid that shows you the development of a person who has faced adverse child experiences. So they have social, emotional, cognitive impairment, adoption of health risk and behaviors, and disease, disability, and social problems causing eventually early death. So the neurobiological effects of childhood maltreatment. So effects of childhood maltreatment on brain development start with repeated exposure to abuse that affects the developing limbic system and the oversensitizing of the system. This also answers another big question that many people have, which is what type of abuse affects a child the most? And the answer is all abuse. It just has to be like repeated exposure. So Teicher, Surrey, Glue, and Sweat in 1993 found positive correlations between childhood maltreatment and limbic abnormality. In 2006, Teicher found that adults who had experienced childhood abuse had more significant limbic system irritability than adults who had no history of child abuse. So this is what really started the question that does childhood maltreatment really affect an adult's development? So with the help of MRI, researchers have seen significant brain differences in the corpus callosum, hippocampus, amygdala, and the cortisol development. So the amygdala is part of the limbic system, and the limbic system is the most affected when it comes to childhood maltreatment. And in the picture, you can see the right hemisphere and the left hemisphere, the connectivity correlated with CTQ. And CTQ is basically measures a childhood trauma using the 5 subscales. So emotional, physical, sexual, emotional neglect, and physical neglect. And this kind of helps researchers and scientists visualize the outputs of the abuse that happens. And same with the hippocampus, you can see the connectivity correlated with CTQ, and the graph that kind of shows us visually the effects of it and the scores, which ranges from 25 to 55. So the next part of the brain I'm going to be talking about is the corpus callosum, and this is a nerve tract with more than 200 million nerve fibers that connects the two brain hemispheres. And it allows the left and right side of the brain to process the motor, sensory, and high-level cognitive information. And as you can see in the graph or the picture of the MRI, this is control, and then this is neglect. So control, this is how the normal corpus callosum should look like, and then this is after neglect. And then there is a scatter plot kind of indicating the childhood maltreatment correlated with corpus callosum. And okay, so the next is the cortical development. And the cortical development is also kind of like the corpus callosum, and in the graph, you can see the early abuse and the cortical development in children. So the left hemisphere, the right hemisphere, and early abuse in cortical development in children. So abused children have greater left hemispheres, and normal children shown in purple. So resilience, so many victims of childhood maltreatment are resilient. Not everybody who experiences childhood maltreatment develops psychiatric symptoms. Resilience is the ability of a child to recover from childhood maltreatment and show early effective adaptation following a potentially traumatic event. So this is gained after childhood maltreatment, and also genetic also plays a big role in resilience, and it influences psychiatric outcomes. So twin adoption studies have shown us psychiatric outcomes associated with early adversity, such as depression, PTSD, anxiety, etc. But this doesn't mean that there are genes that cause such mental illness, but variants adding to the probability of developing a psychiatric disorder. So if a child has gone through childhood maltreatment, having resilience, so building resilience after the maltreatment, such as having a great support system that helps build resilience, can actually cause the child to not have as extreme effects of the psychiatric illnesses. And also genetic, so if their genetics have so the genetic component can increase or decrease the vulnerability in some cases. So my conclusion, so whether abuse of a child is physical, psychological, or sexual, it sets off a ripple of hormonal changes that wires the child's brain to cope in harmful ways. And this is my bibliography, and thank you.
Thank you so much, Israa. Let me just pause the spotlight. Awesome. Thank you so much for that wonderfully productive and inspiring presentation. So we have some questions. One is from Lily, actually, a fellow presenter. That was great. What was your favorite part of the research process?
Favorite part is just honestly just researching about the specific parts and seeing how much each part is affected than the normal brain versus a person or a child who has gone through child maltreatment.
And I guess a related question, what was the most challenging part of the whole research process?
So the most challenging part was honestly finding the information, because this topic, it is like heard about and people have researched about it, but it's not as much as other topics. So actually finding the information and from reliable sources was kind of hard.
Sounds very challenging. I'm sure it's emotionally also really challenging, since, it's
Yeah.
really tough to research. We actually had some questions from the mentor who reviewed your work. One question was, how is childhood stress different from childhood maltreatment? And does childhood stress always come from childhood maltreatment?
Okay, so that's a great question. So childhood maltreatment is the abuse that a child faces, and that actually causes the childhood stress to happen, because the amount of abuse, so repeated abuse, causes the more stress receptors in the brain to have more to be more uh like to be more challenged than a normal child who has not had a history of childhood maltreatment. So I guess morally, it basically um, it's used more in a younger age, and it causes the elasticity of the brain to actually become thinner. So yeah, and it is always caused by childhood stress, because the stress that childhood maltreatment has, not a lot of other things in a childhood has that. So then that mainly causes a great amount of stress.
Makes sense. Makes sense. And a question from me: how are you thinking about furthering this research later on, whether it's in college or later? And has this research experience influenced what you think you might want to major in or minor in future?
Yes, actually. So this all started because I had a passion for like mental health and everything, and I loved learning about it. And I actually found out that, the amygdala and the hippocampus of a normal child versus a child who has been through childhood maltreatment is significantly lesser in volume, which is kind of crazy to me. And so that kind of basically, furthered my interest in this, and I hope to publish this research paper and talk about it in more conferences. And also in college, I actually want to become a neurosurgeon. So, this will be my major in college.
Amazing. Well, you're off to a great start with this wonderful research project. And thank you again, Isra, for your wonderful presentation. If there